Plantar fasciitis, heel pain. The first thing we want to do always is test. So we have something that we can compare to. So if we could just move it and see what causes the pain or step down on it in a way that we can reproduce and test it after we do our treatment. And then we're just going to work on the muscles that help to support the arch so it doesn't fall flat, and stretch that plantar fascia out, pull on the heel, and cause the pain. So the first thing we're going to do is to treat the organ system that's associated, and that would be the adrenals. So if we start at our belly button and we go out an inch, up another inch, right on the abdomen right there, we're just going to put pressure in as deep as we can and just push and circular massage. 12 breaths. Then we're going to go to the muscle that support the arch. The first muscle that we're going to contact is right at the fibular head. It's the bone on the side that goes down to the ankle. There's a knob there, they call that the head of the fibula. And right behind that and below that, we're going to look for some tender spots. And right back there, you're going to find a really tender spot. And we're just going to circular massage that deep as we can. 12 breaths again. And then we're going to pull down on the ankle or flick down on the ankle. The idea is that injury causes us to go, ah, and then we pull that tension back out. It helps the body to relax from the injury that we just treated. The next one is in the lower third of the fibula, and it's right on the back of that bone again. The tendon wraps around here and attaches right in here. So push against the bone, way down here. You should dig in almost behind the ankle bone and in that little groove there, and just find the most tender spot and push in. 12 breaths. Back up top, we're going to drop off the bone into the soft spot between the bones. So now we're just a little bit further back, and we're going to go down that space between those bones. So right there and there too. So I just went down 1 finger width. So you do 12 breaths there. Wherever it's sore, just kind of work your way down. And then same click to reset the injury response, that tension in our system. And then we're going to go to the other end of these. The attachment is on the head of the 5th metatarsal, so it's that bone on the side of the pinky here, but on the bottom. They say your fingers are always as strong, as perfectly strong as you need for the healing that you need right now. And your fingers will get stronger. You'll find a little tender spot there. Push into that, circular massage or back and forth. 12 breaths again. And then on the other side, there's a tendon that actually comes in and attaches in the inside arch here. There's a couple different bones that it attaches to. We're just going to find the most tender ones. We'll have to search around a little bit, and where you find it, then just same thing. Push in, slow it down, circular massage or back and forth across the bone. 12 breaths. And then pull down on the ankle, search around a little bit more. Make sure we've got it. You may have to come back and just recheck these. You'll know where they're most tender now. So recheck them a few times. And then the last step is to push right directly into the pain. And we're going to do the same thing. Push in to as much discomfort as you can take comfortably without holding your breath or biting your lip. But enough that you're serious about this. You want this to be done with and feel good again. And then we're going to leave our hand there and come up to the face point. The purple goes to the bottom of the foot. This is contacting and maybe a little pressure, and then tapping here. And then retest it, step on it, and just let me know how that has improved the pain.